Push, it depends. FDM used to teach, it was a prolonged, sometimes multi-minute hold. I have worked on one CD on an ankle for 15 minutes. 5 minutes here, 5 minutes here, finally broke the FDM rules and grabbed a tool, and it went away and has not come back. I worked with that person again today, and it was well over a year ago that I worked with that HTP. But it can also be, we've learned, that you can get on that CD, or not HTP, that CD. You can get on the CD, and then you can give it a quick bump. Typically, the older ones take a little more pressure. You might feel a change. What kind of a change? There might be like this sense of a vibration, and some of you might go, what are you talking about here? That's what it feels like there's a little fruit fly caught under my thumb sometimes. Dr. Baral, I'm not sure if you're familiar with him. He's a DO who does visceral work. He talks about like highly trained manual hands can feel all these things, and I guess my hands are well trained. But yeah, so it can be either the quick bump or the prolonged push. Again, HTP. Yes. Yeah. HTPs, again, torn fascia, nerve tension, or high pressure. I'm going to throw one more in. It's actually still the high pressure and the nerve tension, in my opinion. Long COVID. I'm also a certified breath training coach. I use exhaled CO2 to help direct my treatments there. I have not yet found a person who had long COVID that didn't have a ton of HTPs throughout their abdomen, especially in those segmental nerves. So if you've got someone who has got long COVID and their sympathetic nervous system is running crazy, and especially if they talk about having the sense they can't physically take a full breath, then those HTPs are likely acting like Chinese finger traps to their nerve. And so as they go to breathe, they're getting this, and their body says, no, you're not. So you go in there and gently clear a few at a time. If you clear too many of those, then you're going to lose a patient. Don't ask me how I know. Because they'll have a huge change in their overall sense. Their autonomic nervous system just gets flared up for a little while. They don't like it. So a couple at a time, and I had that person who I worked with twice, and both times he said, I want more, and I was like, I'm not so sure, and I did more, and shame on me, I knew better. Okay, any questions after the breakout with HTPs and CDs?
What keeps the HTP from re-herniating? What happens to the fascia?
Okay. Sometimes it comes back. Old ones will tend to come back. I think that's because that fascia has now changed to where it's more loose. So there are some super common ones I'll feel here, and they'll branch around here, and in the rear end, those ones tend to be quite old. And even as I push, the texture of it will feel different. And so that fascia doesn't snap back in place very well. Oftentimes also there's some cross bridging that has taken place. So the two layers that are supposed to move over each other now have some linkages, and I'll feel it like almost like Velcro-y pulling through there, and I tell people that's going to bruise a lot and we're going to need to treat it again. Bummer. However, on a fitter, more fit, healthier individual, you'll even feel that fascia close up around that, and so that is what will prevent it from coming back. As with Luke's case with the I call it upper trap HTP complex now, you also need to clear the causative factors. So with that one, I have yet to find a person who doesn't have HTPs that need cleared. They've got a facilitation pattern, which Bill taught me. They'll have HTPs in the supraclavicular nerve, axillary nerve, long thoracic, thoracodorsal nerve, and the suprascapular nerve area. I've got to clear all of those, and what are called trigger bands. We'll get to that, and then it'll stay gone. Otherwise, it's just going to come back for months and months and months. I learned that one the hard way. Also,
if they come back, you may be treating victim and you're missing the culprit.
Yeah.
So you have to sort it out if they come back. You're missing something where they, like Caleb's saying, they have not healthy fascia. Sometimes you can feel it when you push it through. It's like you just push through rotten pumpkin. That's probably not going to hold because it's not healthy fascia.
Continuing to treat it, eventually it will stay. Learned that one also. All right, next, trigger bands and folding distortions. Folds are my favorite. HTPs and CDs suck. They hurt both the clinician and the patient. Folds feel good to the point of when I'm treating a fold, I'm asking, does this feel good, bad, or indifferent? Fold is a particular type of distortion. We've got Folding fascia. Who wants to play with a toy? There we go. And you wanted one here, there you go. So folding fascia, and this is how it should function. If you have said fascia, ankle is the perfect example. Some of you guys might go, actually I have one of those. You get an ankle sprain, so that fascia gets separated and twisted. It won't close well again. Similarly, you can have where it gets compressed and twisted, and then it won't open very well. You can have a combination of those. Think whiplash injury in the neck. And so I'll have, well, this segment needs a refold or compressed down, untwisted, and then it'll move correctly. And this side, lower down, might have an unfold where we need to separate it and then undo that twist and it'll function well. Folding distortions, you're gonna see, they'll describe it or they'll show it with a hold. Really easy to remember, hold, fold. So hey, I've got this neck issue and they're holding it. I'm gonna think fold and I go, yes, it feels good to treat. Another thing that they might describe is changes in weather. So I've got a client from Texas and they have storms that roll through Texas, pretty impressive ones. And you have that bariatric or that, whatever it's called. No, bariatric is fat. Barometric pressure change. And so her folding fascia in the ankle, she had been run over by a skid steer and had ligaments, and, muscles and tendons holding her ankle on her leg. So she had a bunch of folds in there. And I worked with her a couple times in a couple weeks, and then she went back down to Texas, and 6 weeks later she called me, and she said, Caleb, I didn't even realize how effective your treatment was until my father-in-law said how much he felt for me because the storms always caused me issues, and I had no pain. So again, it was another limping around. Storms were brutal. She was like, if a storm, I'll check the weather, and if a storm's coming through, I will cancel things on my calendar. And then I clear a whole bunch of folds in her ankle, and it's gone. But I was able to follow cues and replicate her mechanism of injury as well as I could. And that's another thing with the folds. We're reproducing, to a degree, the mechanism by which it was hurt. So if it was fell off of something and landed on that foot, and now I've got this issue in my foot, and they're coming here, and they're talking again about a deep ache, but they're doing it with a fold instead of multiple fingertips, or they're saying it's somewhere in there. It feels unstable. So again, your ankle sprains where you do all the stability testing, and you're like, no, the ligaments are all solid. The joint play is good. And they're like, it still feels unstable, fold. Clear fold, and now they're sold on you for the rest of their career. Also, they'll talk about it being long-standing. So again, this person, it had been a long, long time before or when she had injured it, so it had been there for a long time, and they'll talk about how it might just be a part of them. It just feels like it's a part of me, that instability, that deep ache in there that changes with the weather, etc. Anything else I should say with folds, Donnie? Folds, think manipulations. You don't have to do a high velocity thrust in Washington on the spine. I can't, stupid Washington. So I will do a long hold instead, and I'll wiggle it, but not the high velocity thrusts. If I could, I'd clear them way more quickly. When you go to a class, then you're doing the high velocity thrust most of the time, not always. Questions with folds. Again, they feel good. If they feel bad, you likely have to do the opposite. I love folds. They're so fun. People like it when I do that. Trigger bands. Trigger bands, I think of a crease in a shirt. So like here, how do I get the crease out of a shirt? I take an iron and iron it out. Creases in fascia, and they can be crazy. I had one today. She cued me. Again, you'll show it with the tip of a finger. So Steph has those. They'll show it with the tip of a finger or fingers. There's a blur there. So she showed me here, and then she didn't want to show me further, and I traced that through here. It split. So we had a couple that went down the sternum, went down the side, and the abdomen. Range of motion was improved, just like if I've got creases in a shirt. Like I've got one in particular that's meant to be all creased up. I ironed it one time, and I'm like, ooh, it does not fit. It's too big. So those creases are going to condense it down and cause some range of motion restrictions. They might talk about a line of burning, pulling pain. Again, they'll show it with the tip of a finger. Arm one is super common with epicondylitis. They might have positional weakness. So external rotators are great, external rotators are weak. External rotators are great, external rotators are weak. Maybe they've got a trigger band in there. Most likely they do. Again, that's one of the things to help you figure out, is this a muscle tear? Is this an HTP? Is this a trigger band? If you test that muscle in a bunch of positions and there's one position where it's weak, especially if they've traced a line on themselves, clear that, recheck, and now you have buy-in. Because if you can get immediate change, patients are like, wait a second, this guy knows something, or this woman knows something. Trigger bands. They'll also talk, as we said, with the range of motion issues, just like if my shirt had a bunch of wrinkles in it, it would be smaller. And then they might have proprioception or balance issues. So a little bit different than the unstable. They'll have some proprioception or balance issues. So they might say, well, I just don't feel balanced on here versus I don't feel stable on my ankle. Questions with trigger bands. Anyone feel like they've got some folds? They feel good to treat. Whiplash injuries, twisted your ankle multiple times. We know we got one trigger band. Anyone have some lines of pain? Luke, we know Steph does. Okay.
I mean, I'll say like with my shoulder, it's hard. I feel like I can't turn on say shoulder press. It's hard to get over that hump.
Okay. Can you stand up and show me?
Rotation. So it's mainly when I have like weight, but when I get to like this point, I feel like I have to really work to get past it.
Okay.
Trying to use like this pec doesn't really.
Is-
I'm turning on up in here like this whole shoulder.
Okay. C6 lower plexus.
So that's.
Okay.
I don't know if that would fall aligned with the.
Are you able to show me, is there anywhere where you feel like,
Can you do something that provokes?
It's not like painful. It's just I feel like I can't.
yeah, are you able, I'll fill this one, Bill, are you able to provoke the symptoms, even though it's not pain, but is there a way that you can say, hey, this, like, here it is, and then show me where you've got a sense of restriction? Because you started to show me HTPs.
Like doing shoulder presses or something, but take that.
At the end, let's dive into what you got going on. Okay, let's really quickly, now I'm not doing great on time, break into small groups again. Donnie will lead one, Bill will lead one, I'll lead one, and we'll take